right, we're live, Dr. Emer.
Hey you guys, it's Dr. Emer. We're at our finishing touches of our halo treatment. This is Profractional Laser Deep Erbium. We're doing it in a specialized setting right now with coagulation so that he gets more improvement for his scars, but also tightening of his skin. Depending on age and what we're trying to achieve, this is a good additional treatment with the halo, but it increases the downtime a little bit and it hurts a little more. So we're using that right now at the deepest levels to improve his specific wrinkles like under the eye, but also here is his acne scars. And we're working, the laser has a large spot size and you can see that it's using a scanning method where it's tracing the skin and delivering the energy at levels where it protects the skin so there's no major damage while it's being produced, the energy is being produced. And it's going really deep. This is one of the deepest lasers besides the limited ultra pulse, which is a CO2. It's a lot of bleeding because this goes very deep into the skin.
Can you talk about the importance of using a combination treatment where you don't just use halo or just use profractional, but you use both?
Especially for my clients with scars like this, you really need to do a combination of things to get the best result. He has very old scars. They're at different depths. They have different levels of difficulty in improving. Hold there, Rosa. Yep. And you need to go, so the halo went a little more superficial. Even with the 1470 going deeper, it's still more superficial. Now we're going very deep with the Profractional. This is going below a lot of the scars and through them. And so you're going to get more of an outcome at multiple levels of the skin, allowing you to treat different types of scars and different depths of the scars. And that's why, there's no cookie cutter setting. Actually, I've never seen a doctor even do this setting before besides me. And this is a coagulation, very deep erbium setting. Much more difficult in knowledge to do. So these combinations are essential. We're also going to combine this with microneedling and PRP so we get a quicker healing for him. And apply topical growth factors, vitamin B, vitamin C immediately so that it heals more quickly. All of that plays a role. I didn't make it up, you guys. I've been doing this for a long time. We used to put Crisco on people's skin to help them heal. And my God, you have no idea how long it would take to heal when we did that. Now, we do more advanced things because we're more advanced. That's what happens as time goes on. You learn about different technologies and treatments.
What's the downtime for Profractional alone?
Well, it depends on setting. Everything always depends on the setting. So anytime they ask, you can just say that. This is probably going to be about a week. He heals pretty unexpectedly fast in general. But in general, it's the setting. I can make it a day. I can make it a week. You can go longer than a week. If we do J plasma or we do a very strong halo with even more profractional. This is a high percentage coverage, very deep as well. A lot going on with this treatment. We have coagulation here. So there's a lot that's going to play a role into how much downtime he has. My suggestion for him would be for the next 2 or 3 days to come and get oxygen facials, maybe even do 1 hyperbaric oxygen therapy, and he'll heal very quickly. And then right when he heals, if he has the time, we'll do the Aerify. Doesn't really have a lot of downtime, it's just a little more red. But it will boost the outcome, for sure. And so this is fractional. At a high percentage, you can see it's scanning multiple areas. There's little dots. Each of the little dots is a hole in the skin that's going to produce collagen.
They're asking, when are you coming to New York?
We're hoping next month. We're going to know in the next week. Right now, we're still on a quarantine to New York, but we're hoping right before end of September, early November. That's what we're hoping. Consult with us now so we can get your skin prepared. That's the key, getting you the right peels. If you just want skincare, email Lindsay at jasonmrnd.com or email us. We'll get you set up for a virtual for skincare. It's almost there on this side. Then we'll get the ice pack on top. The key is to cool his skin down right after this. Yeah, just tell me when. Okay. Turn your head to the right for me. Good. Stay right there in the right position. Your eyes are almost there. Gotta be loud.
Someone's here. You're like, turn down.
Good now.
Then I got to go.
We're almost done on this side. One more row, and then we will be done with Profractional. We'll finish the other side. And what we'll do today is we'll have a testimonial from him at the end. Once the dog before he's gonna leave. Let's get him up close and personal. Get a nice halo. Let's take a look at him. Because he's done this many times and he knows why he's doing it. I think it'll be good for people to see somebody who really cares about a long-term plan for their skin. And the understanding of no pain, no gain. Unfortunately, with anything we do in life. But this is going to be a phenomenal treatment. He's actually never done this setting before. This, what we call coag. So I want to see what he thinks, because I think he's going to be the happiest he's been yet with this. And he's actually done CO2s. So I think with this, and he's never done this, I think compared to the CO2, it's actually more like it's better. His skin's at the level where we can do this, and he gets more out of it, which is amazing. Some areas I'm doing a little bit of an overlap. Okay. Finish up around the pros. Move this work.
They're asking, how frequently can you get Profractional done by itself?
I mean, look, you can do it by itself every month if you really wanted, at the no coagulation setting. But I think every 3 months is fine, 2 to 3 months. You need time for collagen to build, and these are very deep channels. We're doing this a deep way. There's many settings for Profractional. There's also something called contour. So make sure the key is that you guys go to emeraldcosmetics.com, look at the ablative laser package, use the refit and the anti-age perfect. Okay, let's show everybody. Take a look. You can see all the scattered dots. I'm actually going to fill in just a couple little spots. Hold on. An overlap of just a few areas. Perfect. Right here. And perfect. Great. Okay, so now we're going to take our ice pack. We're going to put that directly on here. Go ahead and hold. Turn all the way to the right, and then we're going to finish the opposite side. And then he'll be done once we put the microneedling and the PRP on. Alright, you guys, take care. I'll show you him when he's done.
Beforehand with
Yeah, do you want me to do it right across the line?
yes, please.
Yeah, I'll do that right now.